So you're living your life, things are nice and happy, but then a parent, a sibling, someone in your family develops a retinal detachment. You decide to get an eye exam, and then you meet an eye doctor, and they tell you there are thinning spots or lattice degeneration in your retina, and you develop a concern. Should you treat them? What should we do about these things? Let's talk about it. Hi, my name is Zach Oki. I'm a retina specialist here in Irvine, California. This is a common question, and it's really important that we discuss it. The answer to the question, should I treat these thinning spots to reduce my risk of retinal detachment, is a long, difficult to understand conversation. It's so long and it's so difficult that I've created a multi-part series on this subject. If you're interested in learning all of the intimate, tiny little details, I'd suggest you go look at those videos. I'll do my best to summarize. Lattice degeneration is a very common thing that happens. It's present in 10% of adults in the United States. It's so common, and we know that when these spots inside of the retina are present, that the lifetime risk of a retinal detachment is higher. However, we don't really know if treating them will actually reduce the risk of retinal detachment for all people at all times. Rather, when we look at the risk of retinal detachment, we understand that there are actually other risks that are more pertinent, that are more important to understand, specifically myopia or nearsightedness and age. If you just look at risk factors for retinal detachment and look at people who are just nearsighted, who are over 50 years of age, then you'll find much higher incidence of retinal detachment as compared with, let's say, someone who is not nearsighted, who's younger, who has just thinning spots or lattice degeneration in the retina. But if you look at populations of people, let's say, who are over 50, who are nearsighted, who have lattice degeneration, then their risk of a retinal detachment in a lifetime is higher than people who are just over 50 and just nearsighted. And furthermore, when we find retinal tears, we usually find them in some cases outside of these areas of thinning. And so it stands to reason that if we were to laser those areas of thinning and come away with the impression that we've done such a good job and we've reduced the chance of retinal detachment, we may not actually encounter retinal tears that could lead to a retinal detachment. There is one specific set of people who definitely do benefit from lasering these spots of thinning, and that is people who have had a retinal detachment in one eye. And in fact, I consider a surrogate of that to be a retinal tear in one eye. If they have a retinal tear detachment in one eye, I always suggest lasering the other eye if there are spots of thinning to reduce their chance of a retinal detachment as a whole. Never, ever, ever forget what are the symptoms that we should be concerned about, regardless of whether or not someone has lattice degeneration or not. We should be concerned if someone has